Hi, everyone, and welcome to my little mini podcast today. I'm Eason, and I'll be taking you through a Florida bill that directly impacts occupational therapy practice and the clients we serve. For this assignment, I watched the legislative session for CS/HB 909, which is the Occupational Therapy Licensure Compact, and today I'm breaking down what the bill is about and why it matters and what I learned from watching the legislative process in action. So let's talk about what is HB 909. I chose the CS/HB 909 Occupational Therapy Legislature Compact because this bill would allow for Florida to join the National OT Compact. The whole idea behind the compact is that the occupational therapist or OTA who is licensed in one member state can practice in another compact state without having to get a whole new license every single time. It's basically like having a driver's license that works across multiple states, only for occupational therapy practice. When I checked its progress, the H 909 passed the first committee, the House Health Professions and Programs Subcommittee, with a favorable vote. But after that, it stalled and eventually died in the Health and Human Services Committee. So it never made it all the way to becoming law. So what would this bill actually do? In practical terms, this bill will make it much easier for OTs to practice across state lines. So if you're an OT who lives near Georgia or Alabama border, or if you're doing like telehealth, travel OT, or move it often, like military families, you can treat clients in other compact states without going through months of paperwork and fees. It would also help clients in rural and underserved communities by giving them access to more providers. Florida has big shortages in some counties, especially in the Panhandle and rural Central Florida. The compact could make it easier for out-of-state therapists to fill those gaps. And for safety, compact states share disciplinary information so that it can actually strengthen public protection instead of weakening it. So why this matters for OT and our clients? As a future OT, this bill matters for a lot of reasons. First, it affects our own ability to practice. OT is a mobile profession. People move, spouses move, military families move. Having a compact privilege would make my professional life so much easier because it means I wouldn't have to get re-licensed every time my life changed. It also really affects clients, thinking of families who move states frequently or clients who need telehealth. Without the compact, therapists can't legally treat across state lines, even if it would help the client maintain continuity of care. And for rural areas, there might not be one OT covering there might be only one OT covering multiple counties. Opening practice to nearby states could seriously reduce the wait list for clients. So even though it sounds like a boring licensure bill, it actually has a huge impact on the real access of service. So for the advocacy and what I do, if I were advocating for this bill, I would support it. My main talking points would be about increasing access to care, especially for underserved rural and mobile populations. I would also highlight how it supports the OT workforce, especially new grads, travel therapists, and military connected families. My strategies would include emailing or calling legislators, using social media to break down what the compact is in simple terms, and supporting FOTA's advocacy alerts. Even as students, we can give public comment or send written testimony to communities when these bills come up. So in reflection, watching the legislative session honestly surprised me. I thought it would be a long and complicated, but it moved fast. The bills were presented, questioned, and voted on in just minutes. It made me realize that if you want your voice heard, you have to act early and be clear and concise. I also learned that I'm more interested in policy than I expected, seeing how one vote can determine whether thousands of therapists gain easier access to practice made it feel real. It wasn't just politics. It wasn't just policies. It was about my future career and my clients. Something that surprised me is that even though the bill seemed very practical and had support, it still died later in the process. That showed me how much time in committee schedule and political priorities affect whether the bill succeeds, not just the content itself. If I do something differently, and if I do something differently in the future, I follow FOTA updates more closely so that I know what's happening while it's happening instead of trying to catch up afterwards like I am right now. Overall, the experience made me realize that advocacy is something that we all have to take part of if we want OT to grow and if we want our clients to get the services they deserve. Thank you for listening to my short little podcast on CS/HB 909 and how it affects occupational therapy. I hope this gives you a better understanding of how legislative process impacts our profession and the people we serve.